Invalidation is basically whenever some aspect of our experience has been discounted. And there's different ways of invalidating someone. It could be cognitive, for example, well, that's a dumb way to think. It could be emotional, for example, you shouldn't feel that way. It could be behavioral, for example, a slap to the face. And in my opinion, one of the worst forms of invalidation possible is sexual abuse. Because sexual abuse basically sends the message very loud and clear that you do not matter at all. You do not matter physically, mentally, emotionally, spiritually, sexually. Something that can help us have a better understanding of invalidation is to distinguish between what's sometimes called a big T versus a little t trauma. Big T traumas are obvious and very easy to recognize, whereas little t traumas can be more subtle, not so easy to recognize. Rape would be an obvious example of a big T trauma, but chronic invalidation is sometimes an example of a little t trauma. What we know about little t traumas is that they have a cumulative effect. If we have enough little t traumas, they can be just as harmful as a single big T trauma. In fact, sometimes much more harmful. How do we know that? Well, research has been done on people who have been chronically invalidated, and they develop a very predictable set of symptoms, such as pervasive insecurity, constantly wondering, am I safe? Am I okay? Also, lack of internal veracity or credibility, self-doubt. Can I even believe my own experience? They also tend to experience intrusive thoughts or memories of the invalidation. They might even re-experience the invalidation. They might experience intense shame, confusion, anger, defensiveness. They might have increased sensitivity to invalidation or increased efforts to elicit validation. In other words, avoid invalidation or invalidators. They might also develop an intense distrust in other people. And it might even border on a pseudo-paranoia.